Living with COPD can feel, well, pretty unpredictable, right? Some days are good, some are not so good, and you're never quite sure what tomorrow will bring. But what if you had a clear roadmap? A really powerful tool to help you navigate all those ups and downs. Okay, let's get into it.
Seriously, just think about that for a moment. The second you feel your symptoms start to shift, instead of that feeling of uncertainty or worry creeping in, you just knew. You had a clear step-by-step guide telling you exactly what to do next.
Well, that right there is the power of a COPD action plan, and that's what we're going to break down today. Honestly, it's a total game changer for taking back control.
So first things first, let's get on the same page about what we're actually trying to manage here. A flare-up, or the term doctors use is an exasperation, it isn't just a bad hour or a tough afternoon. It's a real, sustained worsening of your symptoms that hangs around for at least a couple of days. This is the main event that the action plan is designed to help you tackle.
And this is probably the most important part to get. An action plan isn't some generic pamphlet you find in a waiting room. No, it's a personalized set of instructions that you and your doctor create together. It's tailored specifically for you. And the whole thing is built around a super simple traffic light system: green, yellow, and red.
All right, let's start with the good stuff, the green zone. Think of this as your everyday, your baseline, the goal. This is when your COPD is stable and you're feeling good.
So what does the green zone actually feel like? Well, it's your normal. And that's the key phrase here. It's when you're breathing like you usually do, you can get through your daily routine without any extra trouble, and your cough and phlegm are just at their typical level. Basically, things are going well.
And the plan when you're in the green? It's beautifully simple. Just keep doing what you're doing. Stick to your regular medication schedule, exactly as your doctor prescribed, and keep up with your normal activities and exercises. The whole goal of the green zone is, you guessed it, to stay in the green zone.
But, life happens. So what about when things start to feel a little off? Well, that's when we move into the yellow zone. This is your warning sign. This is the time to pay really close attention and take some specific actions to stop things from getting worse.
Now, what's really important to notice here is how specific these warning signs are. We're not talking about vague feelings. This is about real, measurable changes. Are you feeling more breathless than usual? Hearing more wheezing? Is your cough getting worse? And here's a big one. Pay attention to your phlegm. Has the color changed, or is there just more of it? If you're reaching for that reliever inhaler more often, that's a classic sign you've entered the yellow zone.
Okay, so you're in the yellow zone. Now what? Your action plan kicks into gear. First, it will likely tell you to use your short-acting reliever inhaler more often, just as your doctor instructed. Second, and this is a big one, it might tell you to start your rescue pack. This is medication you already have at home. You'll also want to use any breathing and relaxation techniques you know, and if things just aren't getting better. The plan is clear. It's time to call your doctor.
And that rescue pack we just mentioned? It's not some big mystery. This is a great example of what's typically inside. It's a pre-prescribed, short, 5-day course of a couple of key medicines. You'll usually have a steroid, like prednisolone, which works fast to calm down the inflammation in your airways. And you'll also have an antibiotic like amoxicillin to fight off any potential infection that might be causing the flare-up. Having this at home is so important because it means you can start treatment right away.
Okay, now we have to talk about the most serious part of the plan, the red zone. This is when a flare-up goes from being a problem to being an emergency.
And I really just want to pause here for a second, because this is the single most important message. The red zone is not a wait-and-see situation at all. This is a flat-out medical emergency, and you need help right away.
And the signs here, well, they're pretty hard to miss. We're not talking about just being a little short of breath. We're talking about struggling so much you can't even get a full sentence out. You might feel really confused or agitated. And this is a very, very dangerous sign. If your lips or your skin start to get a bluish tint, that's called cyanosis, it means you are not getting enough oxygen.
So the what to do part here is dead simple. There is no guesswork, there is no debate. You or whoever is with you needs to call for an ambulance immediately. That's it. That's the only step. Do not try to drive to the hospital. You need professional medical help, and you need it now.
So we've covered the nuts and bolts of the action plan. But, managing a long-term condition like COPD, it's about so much more than just medication. It's also about the people around you, and it's definitely about taking care of your own mental well-being.
And it is so important that we acknowledge this. Because, let's be honest, living with a chronic lung disease can be incredibly tough. It's completely normal and okay to feel overwhelmed or scared or frustrated. And if you feel that way, please know you are definitely not alone. And for anyone watching who's a caregiver, your role is just vital. You are the second set of eyes and ears. So the best thing you can do is learn those zones, green, yellow, red, like the back of your hand. Know where the action plan is. Know where the rescue pack is. Help keep track of symptoms. Have all the emergency numbers ready to go. And, sometimes the most powerful thing you can do is just be there to offer support. And of course, for everyone living with COPD, taking care of your mental health is every bit as important as taking care of your lung health. It's okay to feel frustrated or anxious. The important thing is to acknowledge it. Don't just try to push it down. Talk to people you trust. Look into a support group where you can find people who really truly get it. And never, ever be afraid to talk to a professional who can give you new ways to cope.
So, when you put it all together, you realize this action plan, it's so much more than just a piece of paper, isn't it? It's your strategy. It's your playbook. It's the tool that turns that feeling of uncertainty into clear, confident action. It really is your path to breathing easier and living a more confident, fuller life.
Which really just leaves us with one final, very important question. If you or someone you love is living with COPD and you don't have one of these personalized plans, what's stopping you from asking for one? This simple tool really could be the key to taking back control.